Hi, welcome to PhDizzle. I'm your host, Alice Cheng, and today we'll be interviewing Lance Cheng, DDS, who got his undergrad in biomedical engineering from VCU and his DDS from VCU, and then did a pediatric residency at NYU Langone in Tampa, and is currently in private practice as a pediatric dentist living in Virginia. Give me an overview of your journey through school and how you decided to be a dentist.
Oh, my journey through school and the whole becoming a dentist, that's actually been a long one for me. I actually started wanting to do biomedical engineering, which is why I majored in it in undergrad. I really wanted to make prosthetic limbs. But then as I was going through my undergrad, I was shadowing a bunch of doctors and shadowing dentists. I liked the individuality that dentists had, because it was, you get to work with your hands, you get to work with people, and it's not bad financially.
Mm-hmm. So how did you choose to go into pediatrics?
When I graduated, I didn't get into dental school at first. So I had a year off where I worked at a pediatric office. And from there, I just it stuck with me. I liked interacting with the kids. I really enjoy working with special needs. And one of the biggest things that's overlooked with people that do pediatrics, for me at least, it's the involvement with advocating for the children. We had to, advocate for the kids because they can't advocate for themselves if they're being abused or anything. We have to report it.
Tell me what dental school is like. I mean, I think there's like the general part of it, and then there's probably a part where you do just peds only, and then you go into your residency. Can you talk about that?
Yeah, so dental school is 4 years. Normally first 2 years is didactic academics, and then third and fourth year is when you finally get into the clinic and start seeing patients. Obviously it's broken down. When you get into dental school, you're trained to be a general dentist. So you learn all the different specialties. And then if you want to further specialize, like me, I specialize in pediatrics, you have to pursue further training. I think the biggest thing that's overlooked is it's not all about, it's not all about being book smart. Because if you're not artistic, you can't work with your hands, you can't, paint or draw or sculpt anything, there's no way you're going to be able to work in the mouth at increments of 0.5 millimeter. You have to be very spatially aware, because it's not just the medicine and the health and the knowledge you need it. It's the art that goes into actually doing the dentistry. But then you bring in the psychological component of the parents, the kids, whether they have special needs or not, the psyche of the kids as they're developing and trying to find best ways to, not traumatize them.
How long was your residency? And then at what point do you transition into?
Residency was 2 years long. So when I was chief, I would tell the new first years that came in is you're being worked like crazy and you're exhausted, you're not sleeping much. You're still responsible for, doing the reviews and research and all while still seeing the patient. And then I'm like, once you finish residency and you go into private practice, you don't have all those extra pressures. Mm-hmm. You can actually just do you and do the dentistry and have fun with it. But if you can do it when you have that much pressure on you and still be, good at it in residency and survive, then once you get into the real world, it should be easier.
Okay.
And from my understanding, from my experience so far, I think I've gotten really lucky. I had a really good residency program. I had good training. So the transition into private practice was great for me.
Right. So now you work in private practice, you're a pediatric dentist, you made it through the residency, especially now we're going through this stay-at-home period. What's going on with your practice?
As of March, I am employed technically, though I'm still responsible for doing emergency calls.
I know there's some residents, dental residents right now that are a resident at a hospital and they're actually working during this time. So are they being repurposed? What can you do as a healthcare worker? I mean, you're technically a healthcare worker, but what are some dentists doing or how do those rules work?
Some schools, they combine the dental students and the medical students into the same class. So everybody's taking the same class together. So that background knowledge is still there. It's just when you delve into the specifics about the neck, that's where the dentists go in. The way my residency worked, when we were at the hospital, we were treated like any other medical resident. So when I was in the emergency room for my rounds, we were responsible for triaging the patient, assisted with, relocate, like popping dislocated limbs back in place, suturing legs, stapling heads together. It was a lot of fun. Completely not what I would do in dentistry, but some other residencies, they are listed as hospital employees and frontline workers. So I know for those residencies that are hospital-based, they still need to report to work, and they're going to be repurposed for triaging COVID-19 patients.
If it gets bad enough when we need more healthcare professionals, do you think like private practice dentists will be called in, or like other medical professionals that, aren't working in a hospital would get called in to help? Or is that like not helpful?
That's a possibility. As of right now, I can't say whether it's going to happen or not.
Yeah.
I know other countries have done it. Other countries, like the dentists have the testing kits. So you could go to any area to get tested, or you can go to like a dentist to get tested. A lot of the offices, since they've been closed down, they've donated a lot of like their supplies, a lot of like their masks and gloves and just PPE in general. They've donated a lot of them.
That's awesome.
So a lot of different private practices are doing that.
Residency was kind of crazy, but given kind of everyone staying at home now, you have a little bit more downtime. So what are some things you like to do for fun?
So a lot of my free time for the past year and a half has been dedicated to my pet rabbit, Alice.
Alice?
Yeah.
Hi, Alice.
I adopted her from the Tampa Humane Society. Probably been the best decision I've made since ever, really. When I was in Florida during residency, I lived by myself, and it was just like really, really lonely. And then I got her, and I was like, oh, I actually had something to look forward to going home for.
Yeah. Oh, that's awesome.
That was nice.
I remember when you and I were in school together, you were into dancing. And so do you still do that?
I have not danced since college.
Okay, viewers, just know this is very improv right now.
We're just gonna go through the motions first of what a lock is.
Okay.
So there's different types of styles. So like I did mainly popping and raving, and then some b-boying or breakdancing. But then there's other styles like tutting and locking, for example. So locking is like very funky. It's a lot of like that. So then there's, popping, which is just waves and such. And then there's robot. And this is all different techniques.
Okay.
I think the easiest and what's really, really popular is locking. So the basic lock, first you want your wrists nice and loose. Okay. You're gonna start with your hands down, and you're basically doing circles up like that. Your wrists are gonna bend inward. Okay. So it's gonna be kind of like, imagine if you had like a spoon, you're scooping inward and then out.
Oh, like this.
Okay. So as you're scooping, you finish with your arms above your head.
Okay.
Arms are like, shoulders are straight out. Once here, you just push down and then bend. So when you bend, it's kind of like you bend one knee, and it kind of gives you a funky look.
Do you want to do it together?
Up. So up, down, lock. Yeah. So it's a roll, down, snap. And then it's just really quick. So it's like, when you hear the beat, it's 1. So it's super quick. And then you could just do this, and then you can bend the knee each time in different directions. And then what some people like to do is you could block, point, or you could throw it around and do different things. So locking. All you're doing, boom, you can do that. There's also a bunch of like steps you can do.
PhDizzle
And Dental Dizzle having fun
and staying safe
with smart people who do cool things.